So you didn't do any of the pre-ups? Yeah. And she was like, you didn't do any of them? In that tone.
Mar is getting married in 38 days. And she has evolved into a bridezilla. Oh. And her bridezilla-ness is not just regarding the wedding, it is regarding her work.
It's affecting the work.
We don't let her see people anymore.
No, she's not allowed to see people.
Not until after the wedding.
She told me that she didn't want to do a video today.
Whoa.
No, I'm kidding. She
always says that.
She always says that.
And I tried to call HR, but we don't have any HR here.
Oh, I'll be HR.
Micah, can you please go do something?
Oh, they wanted me to introduce.
But you're HR.
They wanted me to mark this guy up. This.
All right, let's go.
Like next thing I know, Caridi's gonna hand me the dorsal fin, and.
You've been watching too much Shark Week. You came to us from. You had to fly here, right? We'll just say that. Okay. And how long have you been dealing with gynecomastia?
Probably about 25 years.
Okay, so it came with puberty then?
Yeah.
Okay. And you brought someone with you to take care of you and everything?
My fiance.
Okay. And you've never had your chest operated on before?
Nope.
Okay, we just did a tertiary case. So third time around for that guy. So I like cases like this because Dr. Caridi will be the only one who's ever operated there. We'll do it right the first time, get it taken care of, and move on. All right, let me take a look at you here. Sure. All right, so put your shoulders back there. Super excited about your case right away. I'll tell you all the reasons why. Number one, his nipples, his areola. So when we say areola, it's the dark spot around the nipple, okay? So his areolas are small. So I like that because it goes back really nicely after surgery. It's not a huge areola that has a lot of work to do to come back, okay? So it'll just pop right back. It'll be good. And then you've got great skin. How old are you?
35.
35, okay, good skin. Can you see this, Micah, underneath the areola when you go like this? You can see it move. Can you see that? Mm-hmm. See that? Mm-hmm. So he's got a big chunk of gland in there. Will you love to see it afterwards or no?
Sure.
You're good?
Yeah.
Yeah? We'll take some pictures for you?
Sure.
Will you want to touch it?
I don't know.
You don't know? Okay,
Maybe.
You can decide that later. But so we'll get that big gland out of there and we'll clean this all up. I always say clean it up. I don't know a better way to describe it, but we're not using liposuction for weight loss. Okay, we're using it for contour and sculpting and making this just a smooth chest. So he'll come across here. He has a low point in his chest right here. Very common, no big deal. And but sometimes when you do have that low point there, it makes your gynecomastia even more exaggerated. Mm-hmm. Do you agree with that?
Yeah.
Yeah, because it's low, it's not high, and it just kind of blends in. It's low, and then you've got this. So clean all this up underneath, over here around the arms. Mm-hmm. Underneath the arms, I should say, will be cleaned up as well. Get you all contoured up through here. Mm-hmm. You will be really sore there tomorrow. So I have a lot of patients the next day ask me, hey, my ribs are really bruised underneath my arms and it hurts really bad. And a lot of times at the sternum too, at the midline of the chest, it's really bruised and painful. Totally normal. In fact, the most common place to complain about pain is from that area. And so I hear that all the time. So that will be normal. Mm-hmm. In fact, you can have bruising here and then it travels down in the next few days. So sometimes you hear, hey, I've got some bruising around my hips. Is that okay? It is. Bruising goes with gravity. Totally normal. And so we'll make that tiny incision here at the base of the areola. There will be a tiny incision up here in the axilla and we'll get it all taken care of.
Right.
You excited?
Yeah, I'm excited.
All right. What's the one thing you're looking forward to doing after this surgery?
Let's see. We're trying to plan a honeymoon, so we'll go hit the beach somewhere.
I just had a case just like that. Micah, our videographer, is laughing too because we just literally did a video this morning and his answer was like going to Mexico.
Yeah.
For his honeymoon.
We don't know where we're going quite yet.
Yeah, when do you get married?
Somewhere nice. November 4th.
They're getting married in November too. Really weird. Your fiance isn't a nurse, is she?
She is a sonographer.
Oh, really?
Yes, she works in the hospital.
That's pretty crazy. So, do you have any questions for me?
No, I've seen just about all the videos.
Yeah. Well, thanks for being a part of one.
Yeah.
Sure. It helps people. You know, you learn so much, and then these guys come to us, and then they don't really have any questions because they've already had them all answered, which is good. So we appreciate you guys watching these videos, and our patients for allowing us to do these videos. It's a big deal.
All right, so we're going to do this one a little bit differently because Micah, my videographer, is also our buddy, whatever. And we're going to make him do the examination. I'm going to be there, and
we're testing what he's learned.
and then Lacey's going to do the video. This is our board of how lucky we have people come from all over the states. They're actually from all over the world, but this is just the United States here. And we stopped putting buttons in here, but you can definitely get the distribution that's pretty normal, Northeast. So lucky to have you here. Love your smile and appreciate everything. So we're going to start off with him telling me what you assess him.
And this is what Micah has learned over.
Yeah.
How long have you been working with us, Micah?
I've been with you since like Christmas. So
Christmas.
Yeah.
And
So-
it is August.
Yeah, so not a year. So he's
Yeah.
learned a lot, and he's pretty intuitive, which is really cool. And so at first he didn't know anything pretty much, and now he kind of knows a lot more. So what's your assessment here?
You know, I think that like
Lay it on me, dude.
like
Lay it on him, yeah,
I would say
lay it on
we
me,
were
dude.
talking earlier, and I would say that like he self-assessed himself as like a mild case, and I think that when I first saw it, I would have said, yeah, that's a pretty mild case.
No.
But there is a mass in there that is gonna come
Yeah.
out pretty large.
Yeah, it's not a mild case.
It's not a mild
Yeah.
case, but like even you were saying, you'll take your shirt off at the beach or the pool, right?
Mhm.
Which I think is pretty unique for
mild to
somebody.
him,
yeah,
which
It's
is
mild to
good.
him,
Yeah.
and
Which
it
is
hasn't
a
gotten to his
positive.
head so much that he
Yeah.
won't do that, because you know a lot of people forget it. I mean,
Yeah, sure.
there are people smaller than you that truly have a mild case, and it's like they haven't taken their shirt off in front of anybody
yeah.
since they've been 12 years old, that kind of stuff. So examine him. What do you feel? Can you tell what he's got in there? Feel the stiffness. Yeah.
That's actually the first time I've felt a patient. Yeah, no, I'm like, I can tell that there's a mass of something in here that is not muscle.
Mhm.
And I have never...
Would you say you think it's going to be gland, Micah, or do you think it's going to be more fat? Does it feel hard or soft to you?
Well, I know he said that he's gained weight, but I would say that it probably hasn't caused that much effect to this. This is kind of how it was before you put on a little weight.
That's gland, brother.
Yeah, that's going to be
Yeah.
like...
And Micah,
Let the magic
Micah
hands
has
feel it.
passed the test. He gets to come back for the next video.
Okay, well, it's funny.
Because you can tell, like by touch feel how
Yeah.
much
Well,
gland
I'm
versus-
not so. So you say
I
gland.
think so.
You're not sure.
I think it's half and half, but
Well, I'm not sure. I mean, he has discrete area. There's no question,
Yeah.
and he's got a big thing. There's no question. But is it going to be like the home run concrete? Not so sure.
Yeah. A little bit.
Yeah. Well, I mean, I think it's going to come more like, I'm going to pull out a load, but it's not going to be like that. Oh wow, you know.
Okay.
Will be an oh wow in terms of holy moly, but not. We love the sometimes
Yeah,
just to
to
see
pull out the whole
white
clump.
stuff, you know, the whole clump. So I don't think so, which really goes to my whole thing of why I don't use the diagnosis of what it is, because I
Yeah.
felt millions of these things and I can't tell what it is.
Okay.
So when these classifications that were written years ago, like telling what kind of gland it is, or you can't tell.
And does it matter?
It doesn't matter even if you
Is
did
it gonna
tell.
change
No,
the
no,
treatment?
don't get us going.
Oh,
That's
here
why
we
my
go.
classification system's a little bit different. It's actually based on appearance and treatment. So does he have gyno? You're darn right he's got gyno. Why? You can see it, man. I mean, he's got all this stuff. It's hanging. It's big. It's not like a chest. His muscle's in there, but it's covered up by a whole this thing. All right, so mark him if you can.
oh, okay, all right.
So I got the blue.
Tell me the difference between the
so
blue
the
and the
blue
black.
is sort of the limits of the actual gland, if you
Okay.
will, the gynecomastia.
Okay.
So, but feel. I mean, feel again. And see, like this up here, that's normal, right? That's
Right.
normal. But you feel like this has a beginning and an end, right? You got it
Yeah.
right there. So mark it.
Flex your muscle.
no,
Yeah,
I see,
flex
I
your
see
muscle.
that.
Yeah, you got great muscles.
Oh, we
Yeah.
do.
All right.
Great.
All right.
I would do like that. That feels right.
Okay, I like that.
good.
All right. And this side. No, you don't have to flex. Just let him
This
Yeah.
one, see, goes.
feel it. Go ahead. You got to feel it. Don't,
little
no,
more
feel
of
it. If you don't feel,
A little more of a teardrop on this one. Right?
so we're just marking the extent of the gynecomastia. Just the extent of the gynecomastia. It's not out there. Feel it.
I see. Okay.
Feel it. You got to feel. But you're jumping the gun. Feel that.
I'm failing
Don't
med
mark
school.
what you can see.
See,
mark
this
what you
this
can
is
feel.
fat.
Oh, I see.
It may
what
be
you're saying.
extending a little lateral. You're right. But go ahead. Mark it how you want.
Nice.
Okay. So my assessment will be a little bit different. He's a little bit generous. He goes out here and he does extend out to that to a little bit there. But so that's the blue, and then the black is going to be the areas that we're going to treat, which is all up here. Okay. So that's zone 2, and we're going to get zone 3. That's going to get him a lot more definition. This is zone 1. Some people just have it underneath the nipple. 0, and this is zone 1. So we're going to get all this area here, and we're getting up under here, all that.
And so this is like marking for some of the lipo.
Yeah, so it's like really, it's like this is going to be with the meat and potatoes where I get my finger and get around that. So the idea of removing everything is this is what I'm going to remove. This is the stuff.
Yeah.
This is contouring.
Yeah.
That's not gyno. That's just fat and that's just crap. But the point is, if you don't do that,
You gotta blend. You're gonna
blend in. It's going to look odd. It's going to look uneven. It's like it wasn't done artistically. So the whole idea of doing this is just going to get all these 3 zones. And I love the fact that you say small case, man. I think that's
Hey,
that's
I don't
good,
think you
man.
said small. You said mild, right?
Mild, small, cold. Well, okay, mild.
Yeah.
Yeah. Either way, but I
He's
guess.
gonna be shocked at how.
Yeah. I think the point of this is the delta, the change. In your case, is going to be whoa.
Mm-hmm.
So when we FaceTime tomorrow, we see him
No, I'm
tomorrow.
gonna bring him back.
Perfect. It's going to
He's
be
gotta come back.
whoa.
Yeah.
Now, having said that, guess what's going to look big?
Oh, Front Street.
Well, we can handle that,
Yeah.
because we're guys. But
I
the
get
point,
back to that.
That's right, and you get back to losing your weight because you're going to get motivated by this being cleaned up, and then you're going to really lose a few pounds because you're carrying a little bit too much weight.
Yeah.
And it's not about being a pretty boy; it's about being healthy. And he's young; he's got
Yeah.
a long ways to go. You don't want hypertension and all the crap that comes along, high cholesterol, coronary artery disease, cancer.
We all got a little COVID weight we got to burn off.
All right.
Yeah.
It's 2022. No excuses.
Yeah, we ain't talking
The
anymore,
excuse
right?
is over.
Well, what else, Doc? You have any other questions?
Well, ask the patient. Do you have any questions
You got any
for the
questions?
doctor?
Nope, full confidence, man. I've seen all the videos. I picked you for a reason.
Yeah.
I like
Oh
you.
yeah, that's right.
Yeah, we
And,
appreciate that.
yeah.
And
I wanted to do it right the first time.
Yeah.
That's right,
Well,
yeah.
that's a good question. Yeah. If you, I tell people if they only knew what I want. I never talk about myself because I'm just not that guy. I mean, I'm a humble guy. But the point is, if you knew how much shit I got to deal with in terms of people who vet the stuff somewhere else, and it's just like, what were they thinking?
I know. We just had a case.
Yeah,
we were talking about it.
yeah. Well, yeah, all right, but it's all
Yeah.
good. I mean, the whole point is I'm not the only one. There's other people. Blah blah blah. But just don't just go to someone who you clearly just doesn't feel comfortable with the whole thing. I mean, obviously we're comfortable with this because there's nothing there's no curveballs he's gonna bring my way. I've been here millions of times. His only curveballs, I love that the fact that he says it's not that bad, but yet the delta on him is going to be huge. So that picture that we're going to see tomorrow, that video is going to be awesome. Are you worried about his skin?
I think he's got great skin.
Right, and you know how important that is, right?
Yeah.
Why?
Elasticity.
Right, it's going to go
popping
back.
Yeah.
Otherwise, if someone's big and heavy and lost 100 pounds, it could just sag down.
I mean, I've seen a fair amount of cases. I would say this is probably top 5 skin that I've seen.
nice. Nice
I'll take that.
I take that. I take that and run. So
you're young.
he's got good skin. He's got nice pecs. He's going to get a really nice result here, which is really super cool. He's got to get his posture right so he gets this thing all up and out. That's just an important point. So yeah, you see that? It's almost like when you tell him to stretch out. It's like whoa. But he's got a nice chest. I mean, he's just got a lot of good stuff going for him. And we hope that 1 + 1 is equal to 3 in your case, so that we take care of this, and it's going to help him to lose your weight, get back to where you're, fight and trim. Because I know you were there at one time, right?
Mm-hmm.
That
I
was
was about 184, 185 when I booked with you last time.
That's right,
Yeah.
dude.
200 right
Yeah.
now.
So I mean, you lose that weight because of this, and it's a win-win situation.
Okay, we got to wrap it up, guys.
All right,
this
yeah.
camera is really heavy. All right, we'll see you guys in the OR.
The fun stuff, baby.
They all have it?
So how did you enjoy your debut as a whatever? What do we call it? I mean, you're a guest surgeon or something?
I don't know if
You're a guest surgeon?
I think it was a student.
A student surgeon or a guest surgeon? Or yeah. How did Lacey do with the filming? Did you go over that?
It's a little blurry.
She did all right. There's a
Oh, blurry.
There's a couple blur parts.
Really?
I'm just passed out. My arms were hurting so bad.
Oh boy.
We all got different reasons to pass out.
He kind of seems more fibrofatty.
Yeah, that's why I don't think he's
If
like.
anything, he might
was
not
con-
really have much of a gland.
He's convinced it was. Remember that? He said something. He thought this was like.
All gland.
Just looking at it, he feeling it.
What's fibrofatty mean?
Just fibrosy and fatty.
Yeah.
Not that
Not
it's
as
hard as
bland.
like
Well, that's a good thing anyway, because the fact of the matter is that it's like all these descriptions of the specimens, but I'm trying to hook up a little research at the
And you can
university.
kind of tell also because his nipples, the nipple areola complex, is not as
Big.
big, so you can tell it's more fibrofatty.
Well, not always.
Not always,
Yeah. We always admire people that got a ton of stuff, but then
but
yet
how much?
they don't have a lot of real.
yes, we had 800 left.
Yeah, so you're trying to do something with the university where they study the.
Well, just get a better idea of the specimens, because you know everyone's talking about like type of fatty. Even when I dictate, it's like confusing. I mean, what's fibrofatty? What's fatty? What's you know, you kind of know when it's all gland, but then you don't know anything else. Anyway, so what we're gonna do here is I'm gonna kind of do a bunch of this stuff, and then we're gonna pick this up where I'm pulling out the prize. Okay.
Roll it.
Yeah, you
Okay, so in terms of the quality of the tissue, it's definitely, both those guys are wrong. Your videographer and the patient, they took that big gland. I could tell the minute I was doing the vaser, it was fibrous, so fibrofatty. I already did this side, I'm just finishing up on this side. So most of the work is gonna be with this suction device that I'm using right now. And I mean, I have a little thing that's left here, obviously I'll pull that out, but it's not, definitely wasn't gland the way these guys thought they were. So that's why I don't believe in the whole easy to tell. It's not easy to tell what they got. It's easy to tell when they got thin skin and a lot of gland, I can tell you that, like a bodybuilder or something like that. Not thin skin, but a little bit of fat. But for everybody else, it's deceiving. Like a box of chocolate. You just don't know what you're gonna get.
Box of chocolate.
I got about 500 cc's off that side. Again, I'm doing the lateral zones. Give me a little lube here more.
Yep.
And then going way back here to the
11:30 on mine.
interior border there of the
11:20.
latissimus muscle posteriorly, just to give you some definition back here. On the side, open it up so your arms aren't hitting everything when you move. And if he lost weight, it'll get better in this region, but this also just makes it more proportional from the get-go, so that when he gains and loses weight, it's even. Because if you don't do this, it'll just look funky. And he's got really small areolas, right? The part here, the areolas are small, so I'm glad he doesn't have a big old mass, because it'll just be harder to get out.
Oh, I see.
Although, which I've shown though, I can always get it out. It's funny. Almost never have
This
had.
is not, yeah, I was like,
Never
it's
been
not
unable to get
It's
it
just
out.
not as fun.
Yeah, it's not as fun. It's nice to see that whole big specimen. Any better there? So, it's a little bit up here in the apex. So you can see here's everything. So I got about 1100 cc's in there, so that's a lot of stuff.
Yeah.
So now what
It's
we're
a
gonna do,
significant amount.
yeah, but that's mostly, it's material that can be removed from the chest here with the liposuction canyon. So, little incision here. Turn off that noise box if you don't mind. And, I keep thinking of this, the case we filmed just before him, and I left the fluid in there.
Yep.
That just gets,
It can get
Purposely.
messy.
yeah, it just gets a lot of fluid. So, you know, again, once I use that vaser to get around the actual mass. So you're talking about the blue line here. I use my finger to use that dissection. It's always kind of stuck here at the nipple because that's where it originates. Sometimes I can sweep through there and it pulls it off, but most of the time not. Probably have 5% of cases where I could.
Yeah, very. I feel like that's even less.
Yeah,
It's very rare.
it happens though.
I mean, yeah.
Like see, you can see all the
That's
white stuff
gland.
is always immediately beneath the gland, no matter what. And that's one of the reasons why, if you leave this here, you continue to have puffy nipples. So if you're going to leave tissue, my friend, leave it on the backside, down below, I guess. Or just remove it all and patch it up nicely.
So are there some surgeons that would be done at the point you just finished?
Yeah, well,
Yeah,
if you
just
did,
the lipo
if you did
alone?
lipo alone, yeah, and you can. I mean, I could have got more aggressive with the lipo. I have another cannula I could have used. I could have beat it up even more with the vaser. But at the end of the day, you know, you can't get out something, and that something is always the part that gives you puffy. So you know, I don't want puff titty. Nobody does. Just take it out. You can turn the whole thing off, please, the machine. And cool the room off.
You're doing a fair amount of separating.
Yeah, well, because it's stuck, you know, so I'm trying to poke my finger through the backside here, you know, to free it up, but it's too thick, so I gotta make me a little entrance way, if you will, so I can get my finger in there to sweep it off. Oh. So yeah, you got the meat there. And you got more stuff over here. Like I said, it's stuck up over there. So there's another big piece of gland there. And then Mars just pulling it out, and then stuck. Well, I showed you it was stuck right up over here. Be an army navy.
Yeah.
And by the way, this the really small, so just making this work through. So cut that out. I still got a fair amount of fat over here. I got to contour to make this nice and even. So I'm gonna. I'll show you that now. Give me that suction back.
Lacey, can you turn that on?
So, you know, if you just did this alone and didn't do anything else, you'd be a little low here and be high here. That'd be like that lowness. So up here, I got a little thick up over here. I'm going to contour around the outside, a little bit over here. Kind of bring it all down so it looks more even, more uniform. Okay. And more masculine. So the less layer between your muscle and your skin, the more definition you get. You got to have obviously some fat, but it doesn't have to be a ton. It's got to be in proportion to the rest of your body. And this is before I put in my stitch, which really just closes up the gap even more.
Been doing too many squats, you know?
Ooh, we need our squat break.
Okay. We don't need to get my band. That's big.
1, 2, 3, 4, 5.
FMLA paperwork or whatever.
Uh-huh.
Whoa.
And that's what I
How
asked.
often do they continuously sit? I mean, really?
Whatever you want, honey.
Yeah.
stuff here is clogging. Right there, see what I'm saying? And I'm up over here, so if I look in here, you can see this shelf up over here of fat, right up here. I need the
Cheese grater.
cheese grater. So basically, you know, I'm better here. There's a little bit of fat here, a little bit right here, and this ledge up over here, I want to take that down. But that thing I'm struggling with, so I'm going to get my cheese grater. How much cheese grater is more? Oh, I haven't taken this out. So while they're getting that, I'm going to work on this side. Free this side. This is the one that was the bigger one, right?
No.
Yeah, you did, huh?
What?
It might have been bigger, but this one was like pointier and puffier. Yeah, you might be right.
You want me to turn off the live section?
No.
Okay. Your arm's getting tired?
I'm good.
So I got this kind of glandular part out, but he's still got this underlying stuff that's pretty thick. So let me just see if I can get underneath there. There we go. Sweep around. There we go. And see, he's a diffuse case. You see, like, it wasn't just a big old gland that was like started here and ended there. This is like a fibrofatty, just kind of peters off. So we gotta just chase it and make sure it's sculpted real nice. All right, so that's pretty good there. I got a bunch of stuff I gotta get over here, but that looks pretty good. That's where
The
we
cheese, or do you want the grater?
So
This is the cheese grater.
a cheese
And
grater.
it just basically
Not
it's
really
the.
a cheese
It isn't really
Yeah,
a
it's
cheese
not
grater,
cheese
but it's just the type of cannula, and it's just the way that the holes are.
Yeah, it's a little, just a little bit more aggressive.
That's it. We just call it the cheese grater.
Yeah, we call it the cheese grater. I don't know what the name is. A little bit more aggressive. I love when we do local cases and we tell them,
The cheese grater. They're like,
I asked for the cheese grater and the patient's like, you're asking for the what?
are you making a feast?
Yeah, see how it does a nice job taking that down a little bit more. See, he's a little high right. His ribs are a little high right here. He slopes off pretty significantly. His nipple areolar complexes are a little bit off to the side. See a little bit of fullness here, a little bit there too. Probably that's just water. Yeah, I gotta take this down nice. Even better. And then the regular suction, I slit stance.
You're gonna move that way.
Move that way. And then, so I'm liking this. He's got a lateral nipple, but that's normal. Just to do a little bit more here and here. And I think I'll be pretty much done with the suctioning. In which case all that's left is a stitch.
Lisa lap fell over here.
And yeah, we'll get a little junk out of there, a little water. A lot of water in there. And like I said, his chest is going to be sculpted up really nice, but then his abdomen's going to look bigger because it's not really balanced by his small, quote unquote. What was his word? I don't remember what it is.
Mild.
Mild, yeah, mild. Yeah, this was anything but mild. I always find it curious. That's nice. Boom. I love that. I'm gonna work on this side a little bit. You can see. I don't know if you, Mikey, you can see. A little bit high right here. You see?
Oh yeah,
It's kinda,
for sure.
so once I get the stitch out, it'll get better. But I got to contour this up over here. So maybe you can stay at that angle and you can see
Changes.
as I get my cheese. And I remember this little,
That's not your cheese.
oh, not my cheese. Who Moved My Cheese? That's a book. Who Moved My Cheese? Cool book, actually. I'm gonna get in here with this more aggressive. Yeah, and this is what I was seeing. This. Look at that. See that? I knew there was something hiding. Micah, did you know this was hiding in there?
I have a feeling.
I had a feeling. Yeah, that was that. That was that. I knew there was something hiding in there.
See, he had more mass in there than I think we.
Still struggling a little bit. This right here. And this is an area that bleeds because the vessel's coming here, so we got to make sure we check that it's nice and dry. Okay.
The same area over here,
Yeah.
actually. Micah, can I actually step up there? Sorry, I can't.
Your
Can't see it.
Stitch. Na 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 na. So I'm lucky there's a nice layer here I could work with.
It's in my hand.
There we go. So you can see that's better, right, Micah? Yeah, much better. And then a little stitch here, and one up here, and I dare say, bam, voila. So those were key stitches here. So you can see the contours much better. This will flatten out. He'll massage that as well. It's high on both sides. That's the way his ribs are. And fullness right here. Better. Okay, good. Oh, that's perfect. That's perfect. That's nice. So got a nice layer of stuff underneath there, and that's what she wrote. So there you go. So we're just gonna close this up, and then we're done, and then we'll see him tomorrow.
Yeah.
And I think what you're gonna appreciate is just a big all new chest, you know. And let's see his reaction. If we can get a good reaction. And let the new beginning begin, as they say. So I'm stuffing this in here. Make sure it's nice and dry. That's what she wrote.
Bingo.
Can you see how it looks from the side? And remember how we have this depression here and then we had two mounds over here? Like, that's not like that. It's almost more flush across here.
Yeah, for sure.
Look at it a little more. So this is what we took out. I'll show the camera even though. That's it. Isn't that crazy?
See a picture of that.
You want a picture of it?
Yeah.
I'll get you a picture. It's pretty cool though, right?
Unbelievable.
Yeah. But here, I'm going to show you something a little more impressive than even that. It's a lot. Yeah, it's almost 2 liters. So if that helps you out. Yeah, we got a lot. Keep that in your mind, and I'll show you what we got now. So I always tell people it's going to be bruised, it's going to be swollen. Some contour irregularities because there's fluid in there and all that. But it's just day 1. So you got a long ways to go in the healing.
I can tell the bruising's a little bit low, like kind of down here more.
Yeah, on your ribs.
Yeah, I was feeling it a little bit.
Yeah, for sure. Okay, I'm gonna lay you back just a bit here. You ready?
Mm-hmm.
Okay, go ahead. Okay, is that all right for you?
Yeah, it's fine.
Oh, wow. Yes, it looks great.
Never in my life. Yeah, that's fine.
You see it? Can you capture that?
It's wildly different.
Yeah. And this side, I mean,